any time, and you'll be placed in line to speak with a member of our staff. They'll take down your name and where you're calling from. The next time you hear your name, you'll be live on the call, and you'll be able to ask your question directly. We are just beginning to dial out to households across Douglas County and want to give folks a moment to join the call. My name is Erica, and I'll be your host tonight. This is the 5th town hall that Douglas County has hosted since the start of the COVID-19 pandemic. Our goal is to bring you critical information that can help keep you, your family, or business safe and healthy, physically, mentally, and economically, and to answer your questions about the pandemic and resources that are available. We'd like to set the stage for tonight's discussion. Late last week, Douglas County announced they would be following Governor Jared Polis's Safer at Home order for the coming weeks. We believe this will maximize public health while reducing stressors to the citizens and will enable businesses to slowly reopen and public life to start reassuming some level of normalcy. We encourage everyone to continue demonstrating the public health recommendations found in these orders, including following social distancing guidelines, staying at home as much as possible, wearing non-medical cloth face coverings, and practice abundant personal hygiene and cleanliness to keep our communities healthy and economically viable. But what does safer at home mean, and how does it affect reopening our economy? Tonight, we have representatives from Tri-County Health, as well as Douglas County, the Douglas County Business Alliance, Centura Health, Skyridge Medical Center, UC Health, and Children's Hospital Colorado, who will talk about how we can stay safe as we reopen for business. Now, we know you have questions. In fact, we're already getting lots of them lined up, and we'll get to as many as we can during this call. A reminder, if you're just now joining us, if you want to ask a question, you can press *3 on your phone or send your question through the website. So let's get things started and welcome from the Douglas County Commissioners. First, we'll hear from the board chair, Roger Partridge. Roger, go ahead.
Thank you, Erica. This is County Commissioner Roger Partridge, and first of all, I want to tell everyone on this call, thank you for joining us this evening. And I want you to know we will make every effort we can to make this good use of your time to help us all understand how to move forward as a safer at home county and how we can all stay healthier and, most of all, how we can move forward to reopen our economy. Thank you, Erica.
Great, thank you. And next, let's hear from Commissioner Laura Thomas.
Thank you, Erica. This is Laura Thomas, and I'd like to welcome everyone on the call and thank them for everything they've already done to put Douglas County in a position where we were able to open up our economy while still being safe. I'd like to thank Tri-County Health, the Douglas County Business Alliance, as well as all of the hospitals in Douglas County for their partnership and their leadership at this trying time.
Wonderful. Thank you so much, Commissioner. And finally, Commissioner Abe Layden. Go ahead, Abe. Abe, can you hear us? All right, let's go to Amy Sherman. Amy Sherman from the Douglas County Business Alliance. She would like to share a few words for our business community. Amy, go ahead.
Good evening, citizens of Douglas County. This is Amy Sherman from the Northwest Douglas County Chamber and Economic Development. Tonight I'm here representing the Douglas County Business Alliance, a partnership between all of the Chambers of Commerce and Economic Development in Douglas County. Together, we represent over 4,500 businesses. We know our business community is really struggling during this pandemic, and our hearts go out to you. I want to encourage all of the business owners and employees on this call to stay on the call, and please send in your questions for Tri-County to answer. I know it's a challenge, but we all need to stay informed on state and local guidelines for our economic recovery together. Please rely on your local Chambers of Commerce and Economic Development organizations for information and resources. Thank you for being here.
Wonderful, thank you. And let's go back to Abe, Commissioner Abe Layden. He is now unmuted. Go ahead, Abe.
Thank you very much, and hello, everybody. This is Commissioner Abe Layden. Welcome to the call, and thank you all for your courage and determination to persevere during this difficult time. Partnerships with our citizens, our local, state, and federal governments, as well as our business community, have never been more important in our common efforts to reopen our economy while staying safe.
Wonderful. Thank you, Commissioner. And thank you, everyone, for your warm welcomes. Just a reminder, we will post a copy of this recording to our website in the next 24 hours. And if you're just now joining us, to ask a question, you can press *3 on your phone or send your question through the website. So let's get things started with an update from Jennifer Ludwig, Deputy Director of the Tri-County Health Department. Ms. Ludwig, go ahead.
Yes, great. Thank you very much. And thanks for everybody being on the call today. The timing of this town hall is perfect and critical to really get out some important information on where we are right now in our response to COVID-19. And this next phase, being called Safer at Home, as announced earlier, Governor Polis rolled this out last week and gave us some time to really think about what this looks like, what it means. And earlier this week on Monday, all of our retailers were able to open up to do curbside. And starting tomorrow, many of our retailers will be allowing people to come into the stores. So there's a lot of great things and a lot of progress happening with Safer at Home. So we're moving into this phase because there was evidence that our effort to stay at home helped slow the spread of the virus. So Commissioner Thomas, I'll repeat and recognize the citizens and residents of Douglas County for doing a great job, and to the business owners for doing great jobs of complying with the stay-at-home orders, as hard as they were. But by complying with those stay-at-home orders, it is allowing us to move into this next phase, which means we are still safer by staying at home, but it does allow our economy to start opening up again. This phase does not mean that the virus is gone. Our fight against coronavirus is far from over, but the phase is a slow re-entry while still protecting our most vulnerable populations. So Safer at Home, what it is, it allows many of our retail stores to open with strict social distancing measures. And that means 6 feet between people. It means lots of hand sanitation. It means marking things off. There's a lot of different components depending on what type of business or retailer you are. But retail can open. The other great thing that is now able to open under Safer at Home are personal services, such as hair salons, nail salons, dog groomers, and personal trainers and more. So Safer at Home it also allows us to now gather in groups of up to 10 people, again, practicing that social distancing of 6 feet between people. And in the Safer at Home phase, we are still asking people to stay close to home, meaning that you're limiting your travel and your recreation to stay within Douglas County or stay within your community and really traveling just about around 10 miles, no more. So that means not going down to Pueblo Reservoir to play around on the lake. It means really staying close by, taking advantage of all the great open space and trails that we have in Douglas County. So it's still safer to be at home and in your community. And the key with Safer at Home is to be able to move beyond this, just like with the stay-at-home orders. The better we comply as a community, as individuals, hopefully the quicker that we will be able to continue to build and open our economy and get all of our businesses back to work, be able to gather in larger groups and start to get back to what we think of as our normal life. The last thing that we want to see is a spike in severe illness that would overwhelm the healthcare system, and then they have to go back to orders of staying at home. We all need to do a part in protecting ourselves, our neighbors, our businesses, and all of the employees on the front line. So it's important for all of us to work through and work together in this Safer at Home phase for the next month, just under a month, so that we can start to slowly reopen piece by piece. So I know my colleague from Tri-County Health Department is going to be talking a little bit more specifically about businesses and what can open and what won't be. So I think I'll stop there in the interest of time.
Wonderful. Thank you so much, Jennifer. And we are going to go ahead and go to our first live question. Desi in Parker. Desi, you are live. Go ahead and ask your question.
Thank you very much, and thanks for having these calls, and appreciate all you are doing. Local business question. I operate 2 golf and country clubs in Douglas County. Would like some direction on what pool operations might look like, as well as fitness center operations in the future, and if there'll be any movement in food and beverage opportunities for traffic, maybe outdoors, but just trying to continue to get ourselves in a position to operate correctly and ensure we're doing the right thing. So I wanted to ask those pointed questions.
Great, thank you, Desi. Right now, we do have golf course guidance that we sent out under the stay-at-home orders, still asking golf courses to follow that. Food and beverage on-site consumption is still not allowed under the Safer at Home, so we are following that. Pools are not allowed to be open under the Safer at Home. We don't know what that will look like beyond the expiration date of the Safer at Home, because we don't know if Safer at Home will be extended, if it'll be lifted and we move into a next phase. There have been a lot of questions coming our way about pools, from the country club to the HOA to rec centers. So we know summer is right around the corner, and we have been working with our state health department to try to see if we can find some answers sooner than later to help everybody plan for summer activities and pools. But related to food and beverage, on-site consumption is still not allowed, and we ask that golf courses still abide by the guidance that we provided under the stay-at-home. They're still relevant for Safer at Home.
Wonderful, thank you. Let's go ahead and go to our next caller, who has a question for Melissa Sager. Natalie is in Parker. Natalie, you're a hairstylist. You are live. You can go ahead and ask your question.
Yes, we were wanting clarification on if we have to give or get temperatures of each client prior to performing a haircut service on them.
This is Melissa. It's a good question, and we're working on an FAQ that answers some of these questions related to personal care services. But yes, for personal care services where 6 feet of distance cannot be maintained, you're doing temperature checks on both yourself and your clients, and you'll keep a log of your clients. And the reasoning for that is for contact tracing. So if there's an issue, if there's an outbreak, you've seen a client, you have a log right there that we can see who you've seen and follow up with them with isolation requirements.
Wonderful, thank you. Let's go to our next caller, Taryn. She's in Parker. Taryn, go ahead and ask your question live.
Hi, thank you for taking my question, and thank you for all that you guys are doing. I just wanted to bring attention and some clarification to the wedding industry and private venues. Just because there's no executive orders or guidance surrounding these industries, many venues are still allowing weddings and large guest counts to continue throughout the month of May while refusing refunds. Not only is it impacting our state due to the guidelines for social distancing, but it's also costing couples on average $5,000, if not more. So I was just wondering if you guys can address any guidelines, requirements surrounding private venues, specifically wedding venues, and if these venues should be withholding payments due to the pandemic, and if these venues should remain closed under any executive orders.
This is Melissa again. all public and private gatherings of more than 10 people is prohibited. And so while some of the venues are permitted to be open, the number of people they can have is limited to 10. We are actively looking at this issue. It's one of the ones that's at the top of the list that we're talking about. We would recommend for customers who are losing money to reach out to the Attorney General's office with issues about refunds and things under COVID.
Wonderful, thank you. Let's go to our next question. This is Bob. Bob is in Castle Pines. Bob, go ahead and ask your question.
Well, thank you for taking my call, and thank you for everything that you and everybody at the county is doing to keep us safe. My question is, as we go into this next phase, clearly there'll be an increase in cases, and, we expect that as we reopen. But is there a level at what point you would look at if there was a certain increase to a certain percentage of new cases, hospitalizations, and deaths where we would revert back to the stay at home? Thank you for taking the question.
Thank you, Bob. This is Jennifer, and I'll take that. We would be looking, so yes, we are absolutely expecting to see an increase in cases because we're also hoping that we're doing an increase in testing. So we are expecting that, but what we watch is not just the number of positive cases, but also the number of people who are being hospitalized due to COVID and those in the ICU. So if we start to see large spikes, and we would be working with our hospital systems in all three of our counties that we serve to be watching, and if we start to see large spikes of hospitalizations and ICU admittance, and the hospitals are becoming overrun, overwhelmed, they don't have the equipment or the PPE that they need, that is when we would start working with our county leadership and others to be thinking that, we need to go back. We need to pull back a little bit, and what does that look like? So there's a lot of different factors in that we watch, not just the number of cases, because we are expecting to see more cases, and that just could be because we're testing more. Or it could be, if we start to see severe illness where the hospitals can't keep up, that's when we're really concerned.
Perfect, thank you. And now we have an online question from Michael, and he would like to know, when can we expect phase 2 with gatherings of less than 50 people to go into effect?
This is Jennifer, and I'll take that, and Melissa may have something to add. Right now, we aren't sure. We just entered into this phase of Safer at Home, and it goes through almost to the end of May. The 26th is when it expires. And we have not heard any inkling as to, what that will look like beyond Safer at Home. When can we start gathering in more than just 10? What is it going to look like? We don't know that yet. And, there's a lot of different work groups statewide that are under the governor's direction that are addressing different openings, such as when can restaurants reopen, when can bars reopen, when are we going to be able to watch a ball game again? So I know there's a lot of conversations happening, but we've not heard anything of what's beyond Safer at Home, and when can we gather in groups larger than 10 up to 50 or even more. So we are anxiously awaiting that, and we'll, as soon as we know more, you'll learn as well.
Great, thank you. And now let's go to another online question. This is Nancy S. She would like to know, if a recreational facility has meeting rooms, can they be used while the rest of the facility is closed?
This is Melissa. I will look into that. It's not a question that's come up as far as using rec center space for non-rec center activities. So I'll get back to you.
Okay, great. Thank you. Let's go to James. James is in Parker. James, you are live. Go ahead and ask your question.
My question is twofold. The first one is businesses in Parker like a nail or spa, are they officially open? If not, when are they going to legally be open? My second question is other businesses like restaurants that have told me that they were opening up this week, are they officially open, or is Tri-County applying to Parker with respect to opening up businesses for 10 or more people?
This is Melissa. Spas are closed under the Safer at Home, and so they'll remain closed, and we will be looking for guidance in the same way that we're looking for guidance for pools and other activities. Spas are just a bit riskier. That's not hair salons and nail salons are different. They will be permitted to open, but spas are still closed. And I'm sorry, but I missed the second industry. What was that?
The second industry was the restaurant industry. We were recently at a restaurant that had takeout only, and they were telling us, and they are in Parker, that as of Tuesday of this past week, they are now open for business. And that is not what we've heard from Douglas County in general, as well as Tri-County if Douglas County falls under those rules and guidelines.
That's correct. Restaurants are not open under the Safer at Home. They can continue to do takeout and curbside. We are responding to businesses operating outside the order based on information we've received. And so if you're seeing businesses operating that shouldn't be, we'd encourage you to give the call center at Tri-County a call. The phone number is 303-220-9200. And we'll take that information and get some information out to that business so that they know the parameters of the order.
Great, thank you. And another question for either Jennifer or Melissa. This is an online question. When will I be able to go to the dentist, and is it safe?
This is Melissa. Dentists are permitted to operate currently in all counties. It is dental procedures are regulated separately from the Safer at Home. So there's a separate public health order that authorizes dental procedures to continue. This was in response to the public health order that restricted those non-critical elective procedures. So you can go, dentists are open now. The one caveat is that they have been asked to postpone any basically not having folks in for regular teeth cleaning. So to still restrict those to the greatest extent possible, that if it's not necessary, but to allow those procedures like if you need a filling that you've been putting off now because the previous order said those any procedures that could be put off for 3 months were considered non-essential. And so now things like a filling or a crown replacement can be done, but those regular routine cleanings are still asked to be postponed.
Wonderful, thank you. And again, I just want to remind everyone, if you're joining us, that if you would like to ask a question, you can press *3 on your phone, or you can send your question through the website. Soon, doctors from our local hospitals will be joining us, and they'll be answering all of your questions. So go ahead and press *3 if you do have a question for one of our doctors from the local hospitals. All right, let's go to our next question. We have Heidi in Parker. Heidi, you are live. You can go ahead and ask your question.
Hi, thanks. This is the first time I've done the town hall meeting since the pandemic that I've actually gotten in to get a question answered. So I appreciate it. I'm wondering if you guys are going to make it mandatory for people to be wearing face masks, because I went out to get essential items for my elderly mother, and there are more people not wearing masks than there are wearing masks. And I mean, even in the grocery store, there's people coughing, not wearing masks, and, you know, it's kind of scary. Because, I have an elderly mother I'm taking care of, and, she's in the high-risk group. So it's scary that people, like us are trying to be safe, and there's people out there that just don't even care, and they're acting like life is normal. And there's a lot of that going on in Parker. I mean, I saw a couple restaurants open as well yesterday.
Thank you, Heidi. This is Jennifer, and I'll respond to that. We, Tri-County Health Department, we spent the better part of this week and a lot of today talking about that and talking with our different municipality leadership and county leadership about mandatory mask orders or ordinances, and we have not made a decision if that is something that we will do. We really have been wanting to focus on voluntary compliance and education, and this is just something that we're not used to doing, and it's a little uncomfortable and it's strange, I think we're slowly starting to get used to seeing that, but wearing a mask is unusual for us and it's uncomfortable. But part of social norming and understanding the reason why we do this is to protect others. As you said, we're protecting our vulnerable population. We're protecting our grocery store clerks and our frontline employees. We're protecting the healthcare professionals who are taking care of us by wearing a mask. So a big push that we will be doing one way or the other as the health department serving Douglas County is a lot of social media, a lot of media campaigns, and a lot of social norming around this, and trying to explain the importance of this, why we're asking you to do this, and how it helps. So right now our focus is on developing campaigns that can be sustained for the long haul, because again, masks may not be something that goes away anytime soon. So it is something that we need to get used to and understand why we're doing this. It's not as much for ourselves, but it's for the other person. It's the people that we come into contact with. So those conversations are happening. They will continue. And at this point, we're not sure if that's really what we want to do as a health department and for our communities, but we absolutely want to stress and strongly encourage that everybody wear a mask when they're out in public.
Great. Let's go to our next online question. Stacy, you're live. Go ahead and ask your question.
Hi, thank you so much for taking my question. Under the Safer at Home, we have heard a lot about the retail guidelines, but haven't seen anything that addresses an indoor mall such as Park Meadows. So just wondering if under a Safer at Home, if an indoor mall is allowed to be open, and if so, are there guidelines for the mall?
Thank you, Stacy. This is Jennifer. And in the Safer at Home order, the indoor malls are not addressed specifically. In the guidance that the State Health Department has on their website, indoor malls are not included to open. I will say that we have been working with the general management at Park Meadows Mall, and they have been putting together a plan in an effort to try to open at least parts of the mall and start to try to get some of those retailers back to work and those employees back to work. So I do know, and this was as of yesterday, I would recommend watching the Park Meadows Mall website for more updates. But I do believe Dick's Sporting Goods is planning to open tomorrow. They have an exterior door, and I believe Dillard's is planning to open next week. As far as other stores, we are actively working with the management at Park Meadows Mall to see if we can develop a safe plan that allows employees to go back to work, retailers to open, and customers to shop in a safe manner and while protecting public health. So more to come on that. And as of right now, I don't know what the dates will be for opening.
Okay, wonderful. Thank you. And now we'd like to hear from our local hospital representatives. Many people may not know that Douglas County is the healthiest county in the state. And one reason for that is our high access to and usage of healthcare. However, according to local hospital leadership, we've noticed an unsettling trend occurring even in Douglas County. People are so fearful that they will contract COVID-19 from a hospital visit that they are ignoring very important signs of medical issues that would otherwise warrant a trip to the hospital. Our experts tonight look forward to addressing these concerns and other questions about staying healthy. Tonight, on the line, we have Dr. Shauna Gulley, Chief Clinical Officer at Centura Health, Dr. Michael C. DiStefano, Chief Medical Officer at Children's Hospital Colorado, Colorado Springs, Dr. Jason Kelly, who's the Chief Medical Officer at Sky Ridge Medical Center, and Dr. Tom Purcell, Chief Medical Officer of UC Health Highlands Ranch Hospital. A reminder again, if you're just joining us, if you want to ask a question, you can press *3 on your phone or send your question through the website. All right, wonderful. Let's go ahead and go to a question. We have Sharon, and Sharon is in Parker. Sharon, go ahead and ask your question live.
Okay, do you want me to talk now?
Perfect. Yep, go ahead and ask your question.
Okay, I'm 72 years old, and I have been staying indoors all by myself for the last over 2 months. And I have 3 kids with 10 grandkids here in Denver, and I was wondering if I would be able to see them on Mother's Day since they haven't been able to see me, you know. And then the other thing I wanted to know is if I should go and get a test to find out. I don't think I have anything, but if I should go and get a test before Mother's Day, where would I go?
Perfect, and that's a great question for Dr. Kelly. Dr. Kelly, are you there?
I am, yes. Hello.
Hello, thank you so much.
Yes, thank you for joining, and thank you for asking the question that I'm sure a lot of people are concerned about. I guess I'd start with the testing piece of that. So there are 2 kinds of tests. One is called a PCR test, and that's really if you actively have the virus. And those tests we found are really only positive in patients who are symptomatic and people who are maybe a day or 2 before they become symptomatic. And so those tests also can have false positives or false negatives, meaning being positive when you don't have the virus or negative when you do. And so generally we don't recommend testing asymptomatic people without symptoms, because the probability that the test comes back and gives you a useful result is pretty low. And then there's a second kind of test that's the antibody tests, and those basically show if your body has built up an immune reaction to the virus. One of the problems with that, and actually one of the things that I even learned recently, is that coronaviruses, the whole family, that COVID-19 is one of those viruses, are pretty common, and maybe up to 20% of all respiratory infections, things like common colds, can be due to a coronavirus. And so there's a fair amount of what we call cross-reactivity, whereas, if you have had any type of coronavirus, that it may come back positive. And so there are certainly some downsides to testing, and it may not really make a difference in terms of what you're able to do. And then I would say, in terms of seeing your family, we're certainly trying to relax some of the social distancing restrictions. Given that you're in your 70s, I would certainly be a little bit more careful, and certainly you can see your family, but obviously you want to take some precautions in terms of social distancing and having everybody wear a mask and those kind of things. But obviously being able to see them is important as well. And so I think following those guidelines, you'll probably be okay.
Wonderful. Thank you, Dr. Kelly. And now we have an online question. This question is for Dr. Purcell. They want to know, I'm worried about going to the emergency room. Is it safe for me to go? And are the waits very long? Dr. Purcell?
Yes, good evening, everyone. Thank you for having me on here. It's a great forum. First of all, it's interesting, as was mentioned earlier, we have seen a decrease actually in the number of patients who are coming to the emergency departments. That can be up to 30 to 50% in certain emergency areas. But the concern is that when people are actually coming to the emergency department, they are sicker than we would normally expect, and actually are foregoing calling 911 or coming to the emergency department in an effort to, say, not overwhelming a hospital or worried about contracting COVID-19 when they're actually coming to the emergency room. So that's a concerning thing that we want to try to assure people that all the hospitals are cleaning using highest medical grade standards and have proactive physical distancing measures, sneeze guards, other enhanced cleaning and disinfecting. So we separate patients mostly on the inpatient side. Obviously we separate those into different dedicated units. So I would say, given the question, is it safe to go to the emergency room? Yes, it is, and it certainly is safe when you normally would have chest pain or a change in neurologic symptoms indicating a possible stroke or other types of issues to make sure to go get that checked out, but not unnecessarily. And obviously the safety aspects of preventing COVID is to stay home when you can, obviously, and wash your hands, cover your cough and sneeze, and wear face covering. So it's safe. The waits are not long, and I believe that would answer that question. Thanks.
Great, thank you. And then Dr. DiStefano, could you answer the same question, but as it applies to children?
Yes, thank you. So we, like Dr. Purcell, have put in place very similar measures to protect not only our patients and families, but our hospital staff. So we also have sneeze guards, and we're masking all visitors. We're screening all visitors and employees, so temperature screens and symptomatic screens. So when you start thinking about different places that you will end up going in the safer at home order, the hospitals and healthcare facilities are probably one of the most safest places. Additionally, when you look at our volumes within the emergency department, we're no different in the pediatric world. We've seen a decrease in our volume, and so therefore have capacity. I think we have seen a lot of images that came out of Italy and that came out of New York, and that is not our healthcare system in Colorado, and we've responded as a community very strongly and as a medical community to proactively prepare for the surge in potential patients. So we're ready and able. And I would also, when you start thinking about kids, what's a little bit different with pediatrics is that we have routine health maintenance. And while this doesn't apply in the hospital, it does apply for public health and making sure that the children are still getting vaccines. Many of the pediatricians' offices have those same routines that we have within our hospital to ensure the safety of staff and the patients coming in. But they also have essentially cohorted their clinic to well visits and not well visits. And so you're not intermingling between patients who may have symptoms of coronavirus. So I am urging parents to still get those routine health exams and vaccines, because that will be hugely important as we move forward in this environment.
Wonderful, thank you. Our next question is for Dr. Kelly. And we have Jenny in Castle Rock. Jenny, you can go ahead and ask your question live.
Hi, thanks for taking my call. I was wondering if during an elective medical procedure, can a patient's mask be removed if the procedure requires access?
Hi, Jenny. I'm sorry, access, what do you mean by that?
Under the mask, like a dermatology or skin type appointment, but a medical procedure that's elective.
Sure. The provider in those cases will also be wearing a mask, certainly, and so the provider will be in the appropriate PPE, as we say, the personal protective equipment. So certainly it's okay to remove the mask if that's what the provider needs to do to perform that procedure or deliver that service.
Okay, thank you so much.
You're welcome.
All right, let's go to David. David has a question for Dr. Gully. David, you're live. You can go ahead and ask your question.
Hi. My question is about the COVID-19 condition. I understand that many patients have come in with a reduced blood oxygen level. They may have felt well, but they come in because all of a sudden they don't feel well and their blood oxygen level is dramatically dropped. And I don't know whether this is going along with the high temperature and the cough and the sneezing or things, but is the blood oxygen level something that is unique to COVID that people can be like checking their blood oxygen level that's usually in the range of 92 to 98 or something, and if it drops below that, then they could call their doctor or go get checked.
David, this is Dr. Gully. Thank you so much for asking that question. It's a very complicated question, but you're right. Coronavirus is largely a respiratory disease, although it has many other symptoms as well. One of the things we see when people get quite sick with coronavirus is that they do have shortness of breath and coughing for symptoms. And when they come into the hospital, they do have lower blood oxygen levels. Now, the second part of your question about should we be testing it at home is possible, and certainly you can get blood oxygen meters even online or at REI or common sporting goods stores. But most of the time, that's best left to medical professionals because those can be a little tricky to interpret. So in general, we would recommend that you follow your symptoms, and if you feel sick, you seek out medical attention from your doctor or from your local emergency department.
Wonderful, thank you. And our next question is also for Dr. Gully. Amy Ross in Highlands Ranch. Amy, go ahead and ask your question.
Hello. This wasn't necessarily specifically for the doctor, but it's kind of similar to the question that a previous person asked before. And, you know, what is it that our government officials, Tri-County, our county commissioners could be doing better to ensure that people are wearing masks? Because I live in an area where people are not wearing masks and they're running, jogging, their children are riding bikes, their children are doing spins and circles and meeting up, and as you're walking your dog, they're passing you and breathing and aspirating on you. So the fact that more people in Douglas, in the area where I live specifically, in Westridge, Knowles area of Highlands Ranch, there aren't many signs letting people know. I feel like this could be a Tri-County health task that they could put up signs on around all the parks and public spaces. When you go to the grocery store, people are not wearing masks in the King Supers and things like that. So it doesn't feel very safe to be walking around. And this was my concern when opening up the county. I'd like to hear what you have to say about that.
Yeah, so this is Dr. Gully, and I'll kick it off medically and then maybe ask the county health department to also respond. It's really difficult to control other people's behaviors. So one of the most important things you can do is maintain all of the good practices that we've already talked about today on the phone. Maintaining appropriate physical distance of 6 feet, washing your hands frequently, and trying to avoid touching your face, especially your nose and mouth. That'll really help you reduce the transmission to yourself, even if the people around you are not following the expectations that you would hope they would be doing. I think the safer at home expectations and recommendations will really make a difference in that. But I'd love to know what the health department would say as well.
Great, and thank you very much for taking. This is Jennifer from Tri-County Health Department, and one thing that we have been working on and working with municipality and city leadership is signage. We've been developing different types of signs that can be used by businesses, for parks, for large retailers to post large signage about masks. And there are some retailers who have begun requiring it, like Costco will now require a mask, so you won't be able to shop until you have a mask on. So we believe that we will start to see that more and more, especially with the safer at home and requiring that of business owners such as salons and nail salons, hair salons. Those will be required both for the stylist and the client coming in. So I believe I am hopeful that we will start to social norm this mask. And we are working on some education material, education campaign, social media campaign to really stress the importance of doing this and why we do that. And so it is difficult and it is hard, especially when you're out and about and playing or even running. It's a challenge to run with a mask. But I think we will be working hard, and not just as Tri-County Health Department, but working with leadership across the jurisdiction that we serve to really normalize and help spread the message around why are we wearing masks and why are we asking you to. So thank you for bringing that up and sharing your observation and your passion about the importance of this.
Wonderful, thank you. And now we have an online question. This is for Dr. Purcell. It says, my doctor has scheduled my surgery that I have been waiting for. Is it really okay for me to have it? So just talk about why it's okay to do so as opposed to, before. What is happening now that it's okay now?
Right. That's a great question. It obviously depends on what kind of surgery it is. We are not doing elective surgeries now. We are doing surgeries that are urgent and necessary. And you can define urgent to be something like if a patient, without the surgery, the patient will suffer consequences such as a tumor spread or severe infection or something of that nature, or maybe a moderate urgency of unable to return to work, being a burden on the healthcare system, something that would indicate that. We are not pursuing, so-called elective or non-urgent cases where there's no physical consequences of delaying the surgery. So obviously we've always been, even during the COVID pandemic, doing emergent type surgeries where there's a risk of patients who could obviously die or lose a limb or suffer intolerable pain or life-threatening infection. So we're increasing slowly these urgent and necessary cases. Now, the biggest thing as we continue to, as restrictions are starting to be relaxed and safer at home is going into places. If there or when there are more cases, we have to monitor our ICU beds and our medical surgical beds, both in situations where even in some surgeries, patients have to recover from that surgery in the ICU or in the hospital. And so making sure that we're tracking that very closely and going by the governor's guidelines and the public health guidelines to make sure that we have the capacity and have the capability to pivot if we need to handle a surge of COVID. So it's something that I would talk to your doctor about. A decision to pursue a surgery is obviously between the doctor and the patient, and if it's in that necessary and urgent category, then potentially that would be a case to go forward with.
Wonderful, thank you. Now let's do a poll question. We'd just like to make sure that you stay informed, everyone listening on this call, about what's happening in Douglas County. So if you would like to continue to receive information from the county, please press 1 on your phone now. And then with that, let's go ahead and go to a question for another one of our doctors. Dr. DiStefano, we have an online question that says, should I wait to bring my child in for their regular wellness visit? Dr. DiStefano, are you there?
Yeah, sorry, I was having technical difficulties with the mute button. So that is a really really good question. I think, as you look at well exams for kids, the priority well exams are those that are under the age of 2 because it's associated with vaccinations. And so I would prioritize those in this time. And as we get further down our course of coronavirus and as hopefully things loosen up, then start doing some of those more routine child exams for your 10-year-old, your 12-year-old. With that said, I'd always consult with your pediatrician. Again, a lot of them do have office hours that are associated with just well exams, and then some with sick exams, so it minimizes the risk. But if I was to prioritize it, I'd prioritize for the children that are 2 and younger because it is associated with vaccinations, and those are so critical.
Great, thank you. And we are about halfway through our telephone town hall. This is our discussion about healthy economy and healthy communities. I'd like to hear again from Melissa Sager at Tri-County Health. Ms. Sager, we're seeing this question pop up a lot tonight. Which businesses and facilities are able to be open right now and which aren't?
Yeah, thank you. We talked about a few of them already, but I just want to go through just a general overview of what you can expect to be open and closed over the next few days. I wanted to pull out a few specifically. I know restaurants have come up, and we talked about how we're waiting for that guidance. Playgrounds versus parks, and then gyms versus private training. Actually, first I'll tell you what's open and closed. So starting Monday of this week, retailers, non-critical retailers, were permitted to begin curbside delivery. They will begin in-person sales tomorrow, and also happening tomorrow is personal services can start opening, and that includes personal training, but also includes haircuts, nail salons, and then on Monday the 4th, this coming Monday, offices can begin bringing in their workforce at 50%, but all employees that can work from home are still should be doing that. So this is for those businesses that need an in-person workforce. So playgrounds versus parks. As you may know, parks are open, playgrounds are closed. Gyms versus private training. Gyms are closed, but private training will be permitted in small groups. And the reason for both of those is because of equipment and the ability to keep social distance. So in playgrounds, there is highly touched surfaces that multiple people are touching. It's also difficult to keep a 6-foot distance on playgrounds. It's the same case for gyms. So gyms are filled with high touch surfaces, shared equipment, and it's difficult to keep 6-foot distance. So in a park, you can keep your distance at 6 feet. You can go for a walk, a run, and keep your distance. During private training, you can also keep your distance in small groups, and you can make sure that you're not sharing equipment. So that's why that's the distinction for both of those. And really, that's what plays a role in all of these businesses, whether or not they can open or they need to stay closed, is that some are riskier and it's difficult to keep 6-foot distance and touching surfaces and having other people touch them. It's an issue with restaurants as well. I just wanted to highlight some of the things that are still closed. Gyms, fitness studios, bowling alleys, playgrounds, libraries, again, high touch surfaces, sometimes difficult to keep your distance if people are staying on site. Movie theaters, performance theaters, concert halls, casinos, horse tracks, all of those are still closed. And so as things start to open, the non-critical retailers to in-person, it's phased in. The personal services also phased in. Small groups, personal services will be 10 or fewer, and that includes the person cutting your hair, your personal trainer. Those groups will stay small. And then there's a lot of requirements that come with businesses opening. So in order for a business to open, they have to have a wide variety of precautions in place, cleaning schedules, separated workspaces, lots of signage, educating the public as well as employees, communications to employees of a plan, when do you need to keep things closed, encouraging breaks, making sure people have appropriate protective gear. So these businesses that are going to be opening, they have to ensure that all of their employees are wearing cloth face coverings. Some businesses will have to require gloves. And so while these businesses are set to open and are permitted to open on these dates, not all businesses will. It's going to take some a little bit longer to deputize someone to be in charge of a COVID-19 plan, to make sure they have sanitizer and Lysol wipes and gloves and masks. And so we don't anticipate all doors opening at once on these dates, whether it be tomorrow or Monday the 4th. Businesses are asked to only open if they're set to do so and safe to do so. So I'd encourage you all to look at the requirements of these businesses and have high expectations for businesses when they open, because it's the only way that we're going to be able to keep folks safe and avoid any kind of surge in transmission.
Wonderful, thank you. Next, let's go to Mr. Kim out of Douglas County. He has a question for Jennifer. Mr. Kim, you are live. You can go ahead and ask your question.
Okay, is that me, Mr. Kim?
That would be you.
Okay, yeah, because that's not really that's my first name.
Go ahead and ask your question.
I've been wondering, I've been reading some pretty credible studies lately where there's a lot of, a much higher incidence of the COVID-19 on some random sampling in whether it's LA or in New York, which would make the percentage of deaths much lower by orders of magnitude. And I guess what my question would be, what can you tell me to make me feel good about all the sacrifices that all of us have made, and whether it's financial and whether it's mental health issues, by staying home and shutting down our businesses and everything else? How sure are you, and what can you tell me to make me feel good that we're on the right track and doing the right thing? And are there other theories that might actually be viable?
Well, and thank you for that. And I might also invite any of our doctors on the line they may have other ideas to add or other thoughts from their perspective as healthcare providers. I would say, this is a new virus that we are dealing with, and a lot of what we are putting in place has been, watching this happening in other areas and determining what will work best for Colorado. And it was very hard decisions, and for all of us to sacrifice the changes that we've had to make, and closing down our businesses was no easy decision by any means. We know the economic impact that this had on those business owners who had to close or lay off employees or furlough employees, those who lost their jobs, and for businesses who had to completely change their business model. Restaurants that were never set up to do takeout, all of us had to really shift and figure out how to do takeout on a limited crew, or businesses who had to completely shut down for a long period of time. And our best effort in looking at and modeling and working with the School of Public Health to model out what does this look like. And those are the models that we've been using as a state, and the governor has been using, and we have also been following along and using that and doing our own projections and looking at this. And you may be aware that Douglas County has moved into the safer at home phase because the data has shown us that the rate of cases has slowed. However, Tri-County serves Adams, Arapahoe, and Douglas County. So the numbers look very different in Adams and Arapahoe County. So we have extended the stay-at-home orders for Adams and Arapahoe County. So they are still under the stay-at-home orders. Their retailers are only allowed to do curbside right now. They won't be opening tomorrow. Salons won't be opening tomorrow until May 9th because they are still in the stay-at-home. We are hoping to slow the spread by limiting the number of interactions. So it is difficult. This is something, there are a lot of dynamics working on this. There's a lot of things that we're having to watch. And we don't know if all of these efforts are going to be perfect. We know that they're not. But we understand and realize the sacrifices that we've all had to make and what we've been asking of our communities to make in order to protect the greater community. And we've been following and learning and studying all of the same studies and what's happening in other countries and the other states, and trying to find what will work best for Colorado. And right now we feel, and especially for Douglas County, we feel very good with Governor Polis's safer at home phase and allowing Douglas County to move into that phase. And we will continue to watch and monitor the numbers and monitor people's actions and businesses to make sure that this is the right direction. And if we see that data is showing that we are moving in that right direction, then we can slowly start to open more and more parts of our economy.
Wonderful, thank you. And Dr. Purcell, could you weigh in on this question as well?
Yeah, hey, Kim, this is Tom. I would just tell you that from a hospital healthcare perspective, we heard about this, February, early March, flattening the curve of the surge. And, we ran models, worst case to best case scenarios. And frankly, the worst case or even the medium case scenarios that don't flatten the curve really overwhelm the healthcare system, overwhelm the utilization of ICU beds and ventilators, and frankly, more people, because they may have to have those resources rationed, more people would die. And so going into the social distancing, stay at home was critical for Colorado and the U.S. and the world to do that so that we could flatten the curve and allow us to be able to manage the high volume that it is and the severely ill patients that are there, to where if we had double the amount, it would be there would be a lot more deaths than we currently have. And so, thank you for. I know it is incredibly challenging for everyone, business-wise and psychologically and everything. But I think the concept of preventing the spread such that it doesn't exponentially worsen to a point where we have a surge that's unmanageable from a healthcare system, hopefully can make you feel better.
Great. Let's
Hi,
go to our
this is
next
Dr.
question.
Kelly. Can I chime in as well?
Oh, go ahead, Dr. Kelly. Yes, of course. Go ahead.
I just wanted to add that what Kim is talking about, though, is probably true and is also incredibly good news. If it turns out that we're already at 30% of the people have had COVID, or that we're that much closer to what they call herd immunity, which is usually when 70 or 80% of the population have had a disease, and that prevents the further spread of disease in the population. And so that may actually be very good news for us, that as we expand testing, we really find that a lot of people had it without even knowing that they had it, and we do know that the vast majority of people who get COVID have mild or no symptoms. So I would actually take that as a big positive, that we've gotten much closer to herd immunity in this fairly short period of time.
Wonderful. Thank you for adding to that, Doctor. Let's go to Lynn in Castle Rock. She has a question for either Jennifer or Melissa with the Tri-County Health Department. Lynn in Castle Rock, you are live. Go ahead and ask your question.
Yes, thank you very much for answering all these questions. Mine is a simple one. I've heard what you're doing with the dentist offices and so forth, but I've not heard anything about eye doctors. Are they considered in the same category as a dentist? They can open up, or is there a delay in the eye doctors opening up so that you can get in to get your eyes examined?
This is Melissa. I'm looking that up really quickly. What was interesting with this Safer at Home order is that the state health department pulled out a number of medical procedures, and they're defined as limited health care settings under the Safer at Home. So it's a little different than the other medical procedures you referenced, like dental or traditional medicine. Optometry falls under this limited health care setting, and they're permitted to operate, but the restrictions are a little different. So they have to ensure 6 foot. Let's see. They're supposed to do telehealth to the greatest extent possible. Appointments, services by appointment only, so no walk-ins, no waiting. It needs, and you think of like your traditional glasses store with an optometry office attached. No waiting, just appointment only. And they need to be conducting symptom checks for their customers as well as their employees, contactless payment options, and a few other requirements. And I would encourage you to take a look at the requirements under the order. But yes, they are permitted to operate, and they were permitted to open on April 27th.
Wonderful. Let's go to Steve. Steve is in Parker. Steve, go ahead and ask your question.
Yes, thank you for taking this call. Other than, my question is going to be about service personnel that go into businesses and homes to do service work. Other than masks, gloves, wipes, that sort of thing, are there other guidelines in the Tri-County area that we should be following?
Yeah, that's a great question. There are other requirements. These are defined as field services, so those services that are going to a person's house. There's a variety of different requirements, and I'd encourage you to take a look. But the goal is to be as contactless as possible. These workers should be wearing masks. They should be asking people in the homes if anyone has had symptoms or diagnosed, and they should not be going in if anyone has symptoms. prioritizing remote work. So really just trying to keep as contactless as possible while providing these services. But they are permitted to operate April 27th. A lot of these were permitted to operate as critical businesses. And again, just take a look. CDPHE's website has industry-specific guidance that you can click on and see the requirements for that specific business. And they differ depending on which service. But permitted to operate, they have some suggestions for protecting yourself and protecting customers. But masks, gloves, keeping 6-foot distance, a lot of the same things that we've been talking about.
Perfect. Now let's just go to a quick reminder. As of Monday, April 27th, Douglas County is operating under the Safer at Home order issued by Governor Polis. To find detailed information about how that may impact you or your business, we encourage you to visit coloradosaferathome.com. That's coloradosaferathome.com. Also, we will post a copy of this recording to our website in the next 24 hours. You can visit douglascovid19.org for county-specific COVID information provided by partners throughout the county. That's douglascovid19.org. Okay, now let's switch gears here. Let's ask a question to Dr. Gully. This is an online question. He would like to know, I've heard about plasma donation to help those who have COVID-19. Can you tell us about that treatment and how I can donate?
Absolutely. Convalescent plasma is an investigational treatment for COVID-19, and it's fairly exciting. But I do want to stress that it's investigational at this time. Basically, it gives harvested antibodies to a hospitalized patient. Typically, those patients are fairly sick at the time they receive these antibodies. Many of you know that antibodies are part of the natural immune response, and so that convalescent plasma, as we call it, typically can help, or theoretically can help people improve while they're battling COVID-19. To be a donor, it's a bit of a multi-step process. First, you have to have had COVID-19 and have tested positive for the virus. Then you have to be well for a couple of weeks, 14 days, and then again be tested and test negative. At that time, we assume you have antibodies to COVID-19 and can be harvested. At Centura Health, we partner with Vitalant as our blood donation center, and they have a lot of locations around, including in the Tri-County area. So anyone who feels like they meet those criteria, we would be happy to have your convalescent plasma to treat other people.
Wonderful, thank you. This next question is for Dr. Gully. Again, we would like to see, this is an online question. He says, how do you know if visitors to the hospital or employees aren't sick and bringing in the virus? And how are you keeping families and workers safe? And we'll hear from you, Dr. Coley, and then we would love to hear from Dr. DiStefano on the children's pediatrics perspective. But go ahead, Dr. Gully.
Thank you. That's another great question. Well, we've implemented many safeguards to ensure that people stay well when they enter the healthcare system. So first of all, we screen for any symptoms at the door, and we make sure that everybody is temperature checked. That includes visitors, patients, and all of our staff members and physicians. Then, in addition, just like everybody out in the community, you'll see that everybody's wearing masks. Healthcare providers wear healthcare-specific masks when interacting with patients, but all people in healthcare facilities will be wearing masks. And then finally, we maintain social distance, both at home and at work, because we want to make sure that that commitment to keeping you safe and healthy is first and foremost every day.
Wonderful. Dr. Stefano, would you like to go ahead and comment on the pediatric side?
Yeah, we are doing very similar measures, from screening daily of not only our staff members, but also visitors that come into our facility, masking of everyone, and social distancing. And then additionally, and I'm sure this is the same with Dr. Gully, is that We, if for some reason a staff member gets in a situation where there is risk of transmission or comes in contact with someone, whether it's in the community, we ended up quarantining those individuals, and we do twice daily symptom checks until they pass our quarantine time, which is a 14-day quarantine. So we not only screen, but then we also ensure that if people get in contact with individuals, that they take the necessary steps to ensure that they're not bringing the virus into the facility.
Great, thank you, Doctor. Let's go to another live question. Stefana in Castle Rock. Stefana has a question for Dr. Kelly. Go ahead, Stefana, ask your question.
Yeah, this is Stefana. So I have a quick question. Never had bronchitis before. In October, November, I got super, super sick. Never been that sick before in my whole entire life. And then I got the flu over Christmas. With the reports that I've heard of, that the corona it has been here before, which we originally thought, should I go get tested to see if I have the antibodies, because I did come in contact with a customer that had been overseas? And would it be possible that I have antibodies in my system to help maybe control this?
Sure. Well, it's a good question. I guess I would say that it's possible. I don't think that we 100% know when the first cases of coronavirus were here. But at the same time, I would say that you're probably not going to do anything differently, whether that was coronavirus or bronchitis or, any of the host of other upper respiratory tract infections. And so I think you certainly can go get tested to see if you have the antibodies, but I think, you're gonna still be expected to wear a mask and do social distancing and all of the other things. And so, the expense of that test and the possibility of a false positive or false negative is certainly there. And so I think because you're not necessarily going to do anything differently with the result of that test, that I don't think I would necessarily advise it. I tell a story about one of our emergency department providers who had COVID. He was tested and he was sick and he got better. And I was down rounding in the emergency department, and he was wearing a mask and he was all gowned up and stuff like that. And I said, why are you wearing a mask? You've had it, you're immune. And he looks at me and he says, people kind of look at you funny if you're not wearing a mask. And so I think that's kind of where we're at, that it's really, what we're all doing. And so the results of your test may not make a whole lot of difference. Does that help?
Great, thank you very much. Let's go ahead and go to our next question. This is for Dr. DiStefano again. We have an online question, and they are wondering, how do I know if I should have my child tested for COVID? Go ahead, doctor.
So that's a really good question. I would start this off by saying it would be under the recommendations of your physician, or if you're in the emergency department. Ultimately, what we know is that this is presents in pediatrics like a common flu or common cold. It's not as severe as what we see in our adult patients. And so, what I tell family members is if your child is acting sick and you're concerned that they may end up having the coronavirus, consult with your doctor. But ultimately, what they would all tell you is treat it like it is. And so quarantining inside the house, limiting contact until your child is better. So I would say fever-free for the 24 to 48 hours and no longer coughing. When we worry about it is when the oxygen level is dipping. So if there's any shortness of breath, that's when I'd get a little bit more concerned that you'd have to investigate a little bit further. But if this looks like a common cold, I would treat it as the assumption that it is the coronavirus. And again, it goes back to some of our comments earlier that there are asymptomatic patients. And so when we get through this, we may find that there is a good group of individuals who had the virus and never even knew it. And so I think a general precaution is if you feel like your child is sick, but it seems to be doing well, treat it like it is the coronavirus and quarantine.
Wonderful. Thank you so much. Our next question is for either Melissa or Jennifer with the Tri-County Health Department. This is Brenda from Parker. Brenda, you're live. Go ahead and ask your question.
Hi, I was just calling. I thank you so much for taking my call. I actually work for a gymnastics facility here in Parker, and we are so confused with the guidelines and trying to figure out the best scenario and where we fit in, because obviously we are a kids facility, so we could go into the kids area in terms of that, or we can also be considered a gymnastics or a gym facility, and wondering how that impacts us with private lessons, et cetera, and what the guidelines are for that.
Yeah, thanks for the question. This is Melissa from Tri-County. This is a topic of conversation for us, and I hear what you're saying about, a gym versus like more of a rec center type with kids area. But for lessons and with gymnastics, it's going to fall under that personal training, which is going to be limited to 4 people, including the trainer. And we have had conversations about facilities that are much larger, that have multiple rooms, facilities, huge facilities. But for now, those are limited to 4 people. We are talking about what that can look like in the next phase or next steps. But for now, it's limited to 4 people. Again, just trying to keep those small groups in one location. And then you can rotate those groups to have one after the other, but just 4 at a time.
Great, thank you. Next, let's go to an online question. We have an online question for the Tri-City Health Department, and they are asking, what other things can someone who is high risk do to stay safe if especially they can't wear a mask?
Thank you for that question. This is Jennifer with Tri-County Health Department. And we would recommend, so while Douglas County has moved into this safer at home phase, allowing our businesses to come back to work and retailers to open and for those of us to go shopping and take care of business again, those who are what we're calling a vulnerable population, and that is defined in the order as somebody who is over the age of 65, individuals with chronic lung disease or moderate to severe asthma, individuals who have serious heart conditions or who are immunocompromised, pregnant women, and then also if you have been determined to be high risk by your healthcare provider, that is what when we say vulnerable population, that's who we mean. And the recommendation is to stay at home and only go out when you absolutely have to. So it's kind of keeping yourself in that stay-at-home order until we start to see improvement and we start to lift other restrictions. So especially if you're not able to wear a mask, some precautions or some things that you can do and take. It's great now. We have a lot of home delivery services. So you can have your groceries delivered, or you can do it online and then just drive, pick it up, no touch. They don't even have to run your credit card. You can pop your trunk. They can stick the groceries in. You close your trunk and you leave. Or perhaps you have a neighbor or a relative who can run to the grocery store or the pharmacy for you. So if you fall into that category of being a vulnerable individual or in that vulnerable population, and you're concerned about being out and about, or it's hard for you or you cannot wear a mask, our recommendation is to stay at home and ask others who might be able to help you and run your errands, leave them on your front porch, then you have no contact at all. But do make sure that you're connecting with people through FaceTime or cell phone conversations, because we also understand and we want to make sure that everybody's mental health is good, because we do know that can be socially isolating, but we do want to make sure that your health is protected.
Wonderful, thank you. And thank you also very much to all the devoted doctors tonight who joined us and shared so much useful information about how we can stay as healthy as possible during this time. Just a final reminder, if your question wasn't answered tonight, we encourage you to visit the Tri-County Health website. That's www.tchd.org, or the state site at coloradosaferat-home.com. Now, before we leave, we'd like to give your Douglas County Commissioners a few moments for comments. So first, let's check in with Abe Layden. Abe, are you there?
Yes, I am. Can you hear me?
Wonderful. Go ahead, Abe.
All right. So great questions tonight, and just a few comments. To everyone listening, I just wanted to say thank you for sacrificing each day, for using your unique talents to make this really better for your families, your neighbors, and friends, whether it's saving a life in a hospital when maybe you weren't sure there was enough protective gear, being upbeat and productive on a Zoom call with coworkers when maybe you're not sure if you'd have that job tomorrow. We're so thankful that everyone has worked hard to flatten the curve, protect our healthcare workers, spare the vulnerable, and right now, alongside fellow leaders and experts, we're going to do everything we can to help safely phase back to normalcy as long as the data tells us that it's safe to do so. So we're going to also make sure that we're continuing to help address mental health, fight substance abuse, prevent domestic violence, and help end the jobless claims. And we need your help to do that. This is a marathon, but certainly every time we link arms with our community, we can see that finish line, even though it seems like it's far away. So hang in there, Douglas County.
Great, thank you, Abe. And next, let's hear from Laura Thomas. Laura, go ahead.
Thank you. I'd like to thank the Business Alliance that was on this call. I know that the businesses are really struggling, and we've been getting lots of emails from them, and we can't even imagine where the businesses are, but know that we are trying to figure out how we can help you all get open, because we know that small business is the backbone of our economy, which we care deeply about. I'd like to thank everybody for spending an hour and a half tonight listening to this, or whatever portion that you did. We really are hoping that with a good share of information, we can work with Tri-County and get more and more of our businesses open and get back to life. And for those of you that are supporting your kids at home, know that that's a special thing for me, that we really have to help our kids get through this hard time. So thank you for all that you're doing.
Thank you so much, Laura. And let's now go to Roger Partridge. Roger, go ahead.
Thank you, Erica. And first of all, I really want to thank Tri-County Health and all the physicians who were taking their time tonight to answer these wonderful questions and to give very insightful answers, very informative answers. And I heard a lot of hope in the answers. And that's one thing I think we can all really be pleased with, that we have hope. We have seen things change in the last week, and I think we're going to continue to see things change. And I do hope that we can all be part of this to do what we can to help others, help ourselves to take us to the next step forward. I know Tri-County Health has been a great partner, and we continue to look forward to further solutions to help businesses and employees get back to work. That is one of the things I think we are focused on as commissioners. But it takes the whole community to do that. And I just really want to give a shout out to the hospitals who have suffered through this too. But we're hoping that with this week that they're able to get back to more normalcy and greater capacity to serve the health needs that are more than just coronavirus. So thank you to all the physicians, thank you Tri-County, and thank you to all the callers.
Great, thank you, Roger. And thank you everyone on the call for joining us. Be well. As a reminder, we will post a copy of this recording to our website in the next 24 hours. Again, have a wonderful evening. Thank you for calling in. Good night.